Immerse yourself in a novel.
When you feel a sneeze or a cough coming, try to prevent sneezing or coughing into your hands, as this will contaminate your hands and spread germs. Covering your mouth prevents the spread of germs. You probably knew that, but the way you cover up also matters. And that means breaking a habit you've done all your life. Cover your mouth and nose with flexed elbow or a tissue, not your hands. Discard the used tissue in an appropriate bin immediately. Then, wash your hands with soap and running water to help stop the spread of germs. Turn on water. Wet hands. Apply soap and lather up. Focus on washing your hands for at least 20 seconds. Wash the front of your hands, the back, between fingers and around the nails. Rinse hands under running water. Use something clean to wipe your hands, preferably a disposable paper towel. The best way to wash your hands is using running water and soap, but sometimes we don't have that available. When not available, use hand sanitizer that should have at least 60% alcohol content. Your health is your responsibility. This message was brought to you by the Ministry of Health, St. Kitts.
As fears about the effects of the coronavirus pandemic continue, it is natural that people may be experiencing more episodes of anxiety as a result. Common signs and symptoms of anxiety include feeling nervous, restless, and tense, having a sense of impending danger, panic, or doom, hyperventilating, sweating, or trembling, having trouble concentrating and excessive worry, having trouble sleeping. If you are experiencing any of these signs of anxiety, there are some things that you could do to cope. Reach out for help and talk to a trusted friend or individual who could help to distract you from some of the worrying thoughts. Avoid watching too many news items that focus on the negative impact of the coronavirus. Decide instead on a few specific times daily when you could get your news from reputable news sources. Make sure that you maintain some normalcy and regularity in your daily schedule as much as possible. Focus on the things in your life that you can control and do them. You can control what you watch on TV, what you listen to, who you talk to for support, and how you take care of your body. Remember to seek mental health and psychosocial support if necessary. This message was brought to you from the St. Kitts Mental Health Association. Many people's income has been severely reduced as a result of the pandemic. There are real concerns about taking care of self and family in this current financial climate. In order to help to manage the stress and anxiety related to financial concerns, focus on gathering information. What concessions being offered by banks and businesses could I rely on to help me? Prioritizing. What bills must be paid first? Which ones could be deferred until a later time? Which ones could be negotiated? Brainstorming. What other activity could bring in an income at this time? Remember, financial concerns are very real and could lead to distress and worry if they are left unchecked. Finding a way to problem solve helps to reduce the stress and anxiety that come with financial woes. This message comes to you from the St. Kitts Mental Health Association.
So you understand what's going on?
Yeah man, it's easy.
Okay, cool. Alright then, look like you know what's going on.
Older children may need less supervision, but they need your full support. A few tips for assisting children with online or home-based study. Check in regularly. Ask questions about what they are doing. Don't shout or get frustrated if they don't understand. Encourage them to take breaks from time to time. Be affectionate. Be positive. Sometimes a simple touch goes a long way. As much as possible, provide a comfortable space for children to work in. You may want to be more lenient with the desired study location for teens. Encourage them to focus by minimizing distractions such as television, music, or telephone. As much as possible, encourage them to separate their eating spaces from their study spaces, minimizing the risk of damaging devices.
Is on.
Good afternoon and welcome to the National Emergency Operations Center COVID-19 Daily Briefing for the 8th of May 2020. I am Lesroy Williams. Thank you very much for again joining us for today's briefing. We say a special welcome to Kittitians and Nevisians in the diaspora, whether you're in New York, whether you're in Canada, whether you're in the United Kingdom, students who are studying in Taiwan and Cuba and in other places. Thank you very much for tuning in to this daily briefing. This is where you're updated with the most relevant and important and pertinent information with respect to how everyone in St. Kitts and Nevis is managing the COVID-19 pandemic. We have our health professionals, we have our law enforcement persons, we have government officials, we have the private sector that is working with us, we have the non-government organizations, NGOs, we have the churches, we have the National Emergency Operations Center. We have everyone in the society who is playing their part and playing their role in the management of the COVID-19 pandemic. If you're joining us via radio or television or social media, thank you very much. Today marks 75 years since the end of the Second World War in Europe. And we see that their Victory in Europe Day, that victory first on the 8th of May 1945. And today Europe is remembering the personal stories of people who stood together during a time of national crisis. There was 6 years of war that cost the lives of millions, destroyed homes, families, cities, and had brought huge suffering and privations to the population of entire countries. The political, social, and economic repercussions of the Second World War were great. In towns and cities, this day was usually marked by street parties, dancing, and singing. Today, it is a very somber, a very stoic celebration that we are seeing in Europe and other places. There's no dancing, there's no partying in the street, There's social distancing, just a lane of wreaths, streets are empty. We are fighting another war, that of the COVID-19 pandemic. It is worldwide, and it has already caused untold suffering. It has had, on a magnitude since its beginning, political, social, and economic repercussions that will be felt for many years to come. We are all fighting this pandemic together. Today, we will have a number of presenters. We are going to have the STEP, the General Post Office, Law Enforcement, the Ministry of Health, and the NEOC. I would like to invite, firstly, Mr. William Phillip, who is the Field Operations Manager at the Skills Training Empowerment Program, what is referred to as STEP, to address us. Mr. Phillip.
Good afternoon to the listening public of St. Kitts and Nevis, and also citizens living abroad. Today, I just want to share some information to the public on the operations of the STEP, Skills Training Empowerment Program. I just want to inform the general public that the STEP offices, both in St. Kitts and Nevis, is open to the general public from 8 in the morning until 2 in the afternoon. We're open to collect timesheets and to assist trainees and workers with pay slips and other information, like if you need a job letter, you can come to the office and obtain these services. I want to inform you that at the office, we are practicing the procedures, and we are here to the guidelines provided by the government. We are practicing social distances. When you come to the office, you expect to sanitize your hand with an alcohol-based sanitizer. You're expected to wear a mask. And to adhere to all the procedures that are in place. We at the STEP office are asking all STEP interns, trainees, or workers who are assigned to all businesses, that all private businesses that are given, that are permitted to be open, once you are assigned to that private business, you're expected to go out and work. On the field side, all trainees who are assigned to farms are already being out. Those who are assigned to the various community enhancement group, those persons who are involved in landscaping, they are already out working. And they too are expected to follow the procedures that are put in place. I want to make appeal to the private businesses to come to the office and collect their timesheets so that those persons who are assigned to their businesses could be paid accurately. Remember that we depend on the timesheet for payments. So if you have not come to the office as yet to collect your timesheets, we're asking you to do so. We are asking that all employees go out and do their task. We have been getting a number of questions. The public is calling asking who should go out to work. We are told by some private firms that when they call their workers who are assigned to their businesses from the step, they are saying that they have no information whether they should return to work. So we're using this opportunity today to say to you that the step is open for business. One can also call in to the office and request information. If you can't make it to the office, you can also call in to the office and request information that our staff will give to you. Those persons who have email and they're registered with the STEP office, we are going to be sending emails via timesheets. Timesheets via emails. So if you haven't got an email with your timesheet, your request to come to the office to collect that timesheet. It's a possibility that if you don't do so, your worker could not be paid. So I want to stress again, it's very important that you come to the office and collect your timesheets and you submit your timesheets on time so that your workers can be paid. The farmers, as I said before, they are out. Landscapers are out. The only group of persons we are not expecting to be out as yet are the persons who are assigned to the various daycares, nurseries, and schools as assistant teachers. As soon as these operations are ready, information will be passed on to everyone. So we're expecting going forward that the operation of the step will be returned to normalcy. I want to thank you for this opportunity for this short presentation, and I will be around just in case there might be any questions. Thank you.
Thank you, Mr. Philip from STEP. I now invite Mr. Dario Gill, our Postmaster General, to share some remarks with us. Mr. Gill.
Good afternoon, everyone, and good afternoon to persons viewing by ZIZ television, persons viewing by the internet, listening by radio or by the internet. Let me first thank the COVID-19 task force for the opportunity to give some brief remarks about the operations at the General Post Office. The opening hours at the General Post Office for the past 3 weeks or so has been from reduced hours from 8 to 1, and that's also at the sub-post offices as well. 5 sub-post offices, going east, Keon, Tabernacle, Date Bay, Sandy Point, Old Road. So for the next 2 weeks, from the Prime Minister's message last night, it would be a 5-day work week. So we would be working 5 days from 8 to 1. Now, the services at the General Post Office and sub-post offices, the services remain the same as pre the COVID pandemic. So the sale of stamps, cashing of Social Security checks, distribution of NCI checks, if persons are sending parcels to the US, that is facilitated. So that hasn't changed. In terms of the parcel posts, the collection of parcels, small packets, any items through the US mailbox or express mail, that is, we also facilitating that as well. The delivery of mails throughout the island by the postmen, that continues as well. And also the transportation of mails via ferries between St. Kitts and Nevis, that continues. Now, just to mention, I was speaking to my counterpart, the deputy postmistress in Nevis, Mrs. Rhonda Williams, and she indicated to me that their hours would be 8 to 1 as well. Now, the philatelic bureau located in the Pelican Mall, that is closed since we had the total lockdown, and that remains closed. The reason being, because our borders are closed, no cruise ships coming, and the majority of the persons who go to the philatelic bureau are persons in terms of stamp collectors. So because there are no cruise ships, there's no reason to have the philatelic bureau open. So that would remain closed until further notice. Now, I'd like to mention something very important here now. This notice has gone out already, but I'll use this forum to reiterate. Due to the airport the various airport closures and border shutdowns in response to the COVID-19 pandemic, most airlines have implemented travel restrictions to the following destinations: Antigua and Barbuda, Anguilla, Barbados, Bermuda, Canada, Cuba, Dominica, Guyana, Grenada, Jamaica, Montserrat, St. Lucia, Trinidad and Tobago, St. Vincent, Grenadines, St. Martin, Tortola, BVI, French territories of Martinique and Guadeloupe, Great Britain, Europe, and also all nations in the Middle East and Asia, as Great Britain is the transit office. Now, based on the aforementioned, the post office will not be accepting any mails for the countries listed. Okay, and the list will be updated as more information becomes available. We are only accepting mails for the United States and the United States territories, Puerto Rico, and the USVI St. Croix, St. Thomas. AmeriJet comes, well, for now, AmeriJet comes once a week on Tuesdays, bringing cargo. So if anything is going to the US or the territories, we would facilitate it through AmeriJet. Now, in conclusion, I'll like to encourage the general public to observe all mandatory safety and hygienic directives before accessing the customer service area for the safety of all staff and customers at the General Post Office. We have markers at the corridors and inside the post office, so you stand 6 feet on the outside and inside. You wear a mask, which is mandatory this time, and sanitize hands on entering the building. A maximum of 5 customers is allowed to enter at any time. That's at the section where you go in if you're going to be, purchasing stamps, or by the water section is located in there as well. So no more than 5 persons at a time. And the parcel post section, it's no more than 3 persons at a time, because that area is a little bit smaller. So, in conclusion, I'd like to thank persons for the opportunity to be here today, and ask everyone to stay safe. Thank you. I'll be around for any questions.
Thank you, Mr. Gill, our Postmaster General, for your sharing. I would now invite the Honorable Wendy Phipps, Minister of State responsible for Health, Community Development, and Social Services, to share some remarks with us. Minister.
Thank you very much, Lesroy, and to the listening, viewing, and streaming audiences throughout St. Kitts and Nevis and wider afield, good afternoon or good evening, as the case might be. Now, I was not scheduled to be on the program today, but in light of a significant development that we've had in terms of our own development of our people, and in honoring persons who would have amassed a significant milestone in terms of their longevity, I am here this afternoon to once again extend heartfelt birthday greetings to the Federation's newest centenarian, who happens to be a gentleman by the name of Vernon Roy Connor, who is resident in Soho in Bastille. Mr. Connor would have been born on the 8th of May 1920. He's originally from Anguilla and would have worked in various places throughout the Caribbean until he came right back here to St. Kitts and would have had a career in the sugar industry. Now, his children would have put on a very novel but apt ceremony for him via Zoom this morning. A little tiny bit of it I had the opportunity to be online for. It was being streamed out of St. Thomas, Charlotte O'Malley, and of course the venue for that would have been the Niski Moravian Church in downtown Charlotte O'Malley. Now, the Ministry of Social Services would have been online this morning. As part of the greetings, Ms. Scarborough and Ms. Oslin Ward would have extended greetings on behalf of the government. Unfortunately, I could not be online for very long, but I just wanted to join with everybody else throughout the length and breadth of the Federation and elsewhere afield to say congratulations to Mr. Connor. Mr. Connor now is the only centenarian who happens to be a male in St. Kitts and Nevis. By extension, that makes him the oldest male in the Federation. We have a total of approximately 5 centenarians now, the other 4 being females, I think 2 on St. Kitts and the other 2 on Nevis. So on behalf of the government and people of St. Kitts and Nevis, we say a hearty 100th birthday in the middle of all of this pandemic. And it just goes to show you that this gentleman would have weathered the storms in terms of the First World War, the Second World War, Vietnam War, the Gulf War, and now here we are in this pandemic. So bravo, Mr. Connor, and do enjoy your birthday.
A tremendous feat indeed, and we congratulate all of us from the NEOC. We also congratulate Mr. Vernon Connor. I would now invite Superintendent of Police, Cromwell Henry, Divisional Commander for District A, to give us his report. Superintendent.
Thank you, Mr. Williams. I will begin. Good afternoon, all, and welcome again to this briefing. I will begin with the arrest statistics for the past 24 hours. For the past 24 hours, police have made 4 arrests for persons who breached the curfew last evening and for persons who would have failed to wear their masks. This brings to date the total number of arrests to 120. Of that 128 were for failing to wear masks. The remainder were for breaching the curfew at nights. Regulation 15 requires a person to wear a mask, a face mask, covering the eyes, mouth, when in a public place. Dr. Wilkerson and the CMO have both gone to great lengths to explain the purpose of the mask, how to wear the mask, what type of mask you should wear, and how to dispose of them. I must say that from my observation, the majority of persons are wearing their masks, even though a good number that I have seen are wearing them under their necks. But Dr. Wilkerson had explained that on occasions you could remove it if you're by yourself and not in close proximity to anyone else. You could remove it until you become close to persons, because the mask could get uncomfortable at times. But as long as you are in close proximity to other members of the public, your mask should be covering your nose and your mouth. We again appeal to persons to comply with this specific requirement. It is one of the things that would keep you safe, prevent you from becoming infected with the COVID disease. Today is the final limited operation day under the current regulations. which expires at 5:59 a.m. tomorrow, Saturday night. The nightly curfew begins at 7:01 p.m. this evening, and motorists are again reminded to give yourselves a reasonable time to get to your residence before the curfew begins to avoid traffic accidents. The police are currently investigating 2 traffic accidents which occurred yesterday evening close to curfew time and can be attributed to the rush to beat the time. We again appeal to you to give yourself sufficient time to get off the road and do not wait until it's close to the curfew time to break all the traffic rules to get home. New regulations have been published and will take effect from 6 a.m. on Saturday 9th May until 4:59 a.m. on Saturday 23rd May. The new regulations provide for a 24-hour curfew on Saturday 9th and Sunday 10th May. This means that residents are required to shelter in place at their homes, with the exception of persons who are deemed to be essential workers, who are required to report for duty. If you are a worker at a medical facility or hospital, or if you are required to travel for essential medical emergencies, and if you are also exempted in writing by the Commissioner of Police. All businesses are required to remain closed on these days, of course, except for hospitals and medical facilities, businesses that provide private security and guard services, and other such businesses or undertakings that are specifically exempted in writing by the Commissioner of Police. We ask all to comply with these regulations, bearing in mind that they are all intended to keep us all safe and to prevent us from becoming infected with the disease. I want to wish you a pleasant weekend and be safe. Thank you.
Thank you, Superintendent Henry. I now invite Chief Medical Officer Dr. Hazel Laws to give us the health report.
Good afternoon, everyone, and thank you, Mr. Williams. This afternoon, I am going to use a different format for presenting the usual daily health emergency operating center report. So this afternoon, I'm presenting the report for the Federation of St. Kitts and Nevis, the Ministry of Health. We usually use data from the World Health Organization. This data is verified. And today, the total number of confirmed cases globally stands at 3,759,967. The total deaths are almost 260,000. Now let us look at testing. To date, 327 persons within the Federation have been sampled and tested. We have had 15 confirmed cases and 311 of the samples returned negative. Again, I want to underscore that we continue to test individuals who are suspected cases, persons who would have signs and symptoms of COVID-19, persons who would have met the definition provided to us by the World Health Organization. We also tested contacts, and we have also tested individuals who would have come into country from hotspots. We've had, as I said before, 15 confirmed cases. We would have announced our first 2 confirmed cases way back March 25th, and on March 29th, we announced a further 5 positive cases, and on April 19th, that is 19 days ago, we announced our last or 15th case. So in total, St. Kitts has had 11 confirmed cases, Nevis 4 confirmed cases. Let me just share some demographic information with respect to the confirmed cases. Now, in terms of gender, 53% of the cases are male, 47% female, and this is in keeping with the global or international trend. In terms of clinical manifestations, 87% of the cases presented with symptoms, and 13% were symptom-free throughout the course of the disease. The most common symptoms noted amongst our patients were fever, cough, sore throat, weakness or malaise, and some complaint of runny nose and headache. Now, in terms of some other information, demographic information, the cases, the age ranged from 9 months, as young as 9 months, to 66 years, and the mean age was 32 years, and 60% of the cases fell within the age band 20 to 40 years. The incidence rate with respect to cases in the Federation, 3 per 10,000 of the population. Now, let's just talk about a little bit about transmissibility of the new coronavirus within the Federation. Now, there is a statistic deemed or termed the reproductive number. This describes the level of contagiousness or transmissibility of the virus. It gives you an idea with respect to the number of new cases that an existing case generates. And so because of the public health measures that we employed here in the Federation, we have been successful in reducing the reproductive number to less than 1. Based on our data, it's about 0.3 to 0.6. And it's because of this achievement we have been able to contain this first wave of infections. The next slide shows that of the 15 cases, of the 15 confirmed cases, only 3 cases transmitted or passed on the virus to 1 or 2 close contacts. The other 12 cases did not transmit or pass on the virus to anyone. Again, this is an achievement because of the stringent public health interventions that we employed. Of the total 212 contacts traced, only 5 cases were positive. Now, as at today, May 8th, we have a total of 56 persons in quarantine in a government facility. We have 4 persons quarantined at home, 2 persons remain in isolation. And I want to bring you the good news that we now have 13 cases who have recovered. Number of persons released, the total number of persons released from quarantine stands at 752. Let me repeat, we now have 13 cases who have recovered. All right, so this slide highlights that. And so in St. Kitts, we have 9 cases who recovered, and then all 4 cases in Nevis have recovered. The average duration, well, based on our data at the Health Information Unit, the average duration between diagnosis and recovery is approximately 30 days. And so, ladies and gentlemen, we have been able to achieve this through our local or national operational response. And let me just summarize briefly. And so the Ministry of Health, we developed and updated our National Pandemic Virus and Infection Preparedness and Response Plan. And this plan provided us the roadmap, which we followed over the past 3 to 4 months in terms of managing this outbreak. Very early on, in January, February, we sensitized and trained the staff, not only in the Ministry of Health, but across sectors. Surveillance. We stepped up and strengthened our surveillance, particularly at our ports of entry, very early, again, from as early as January. And this continued, and we were able to pick up our cases, identify our cases very quickly, and we were able to aggressively trace all their contacts. In terms of infrastructure, there's so many things that we did. For example, at the JNF General Hospital, changes in the emergency room, in the various health centers. We have tents erected at the Mary Childs Hospital, at the Poxon Hospital, and so we strengthened much of our health system in preparation and in response to this outbreak. And some of the main public health interventions employed include a massive public education campaign, and that we are very proud of. We really, encouraged everyone to be active in terms of hand and respiratory hygiene, physical and social distancing. We were able to achieve this with the aid of the announcement of the state of emergency and the curfews. Next slide. And then the legal framework, as I mentioned, the state of emergency and the various regulations that provides the framework for us to enforce physical and social distancing, and for that we are thankful. And then in terms of emergency supply chain, very early in the game we sought to procure the required equipment and medical supplies that would be necessary to fight this outbreak. And then I think we can say with pride that it has been an all of government, all of society response, and we couldn't have done it without collaboration or collaborating with our local, regional, and international partners. We want to say thank you to the local entities, public and private, who have been so generous in their donations. The Caribbean Public Health Agency, in terms of the lab, that provides us support in testing our suspected cases and our contacts, and the capacity building that the Caribbean Public Health Agency provides. The Pan American Health Organization's office in Barbados, very, very helpful in terms of capacity building and technical support as we fight this pandemic. The World Health Organization in providing us the well-needed resources, case definitions, etc. And the International Atomic Energy Agency, who is now providing us with a molecular machine, thermocycler molecular RT-PCR machine. And so very soon, St. Kitts and Nevis will be able to offer the molecular RT-PCR test in the public sector. And so for that we are thankful. And I want to end by providing the websites on which you can log on to these sites and access the national statistics for COVID-19. Thank you.
Thank you very much, Dr. Laws, for that report and the innovation that you brought to that report. I would now invite Mr. Abdias Samuel, Chair of the COVID-19 National Task Force, to address us. He will be accompanied by Ms. Mercelyn Hughes, who is head of the Compliance Task Force.
Good afternoon all, and thank you, Mr. Williams. To all our citizens, residents, and friends who are watching via all means. I want to start out this afternoon with an article that I read on CNN online. And it's reference a farmer and his sick wife who would have made a donation to Governor Cuomo of one N95 mask out of 5 that he had in his possession. And I am first going to start with the quote that Governor Cuomo in New York City, New York, in the state of New York, ends with. How beautiful is that, Cuomo said, of their sacrifice. It's that love, that courage, that generosity of spirit that makes this country so beautiful. And this was in reference to this special sacrifice made by this farmer, and he's a retired farmer of 70 years of age. And he asked Governor Cuomo to do one thing, to please give a nurse or a doctor this one N95 mask. And he pleaded with Governor Cuomo to please keep doing, and I quote, please keep doing what you do well, which is to lead. Every time a citizen, resident, or friend of St. Kitts and Nevis makes a special sacrifice to donate or give of their time, selfless time, to the operations of the fight against COVID-19, we must hail such selfless acts. So with that said, I want to take the opportunity to read 2 letters that was brought to me. Well, one, I actually had to go to government headquarters and meet this couple. And it reads, please accept this small donation for the COVID-19 task force to use as they see fit. We believe that you have done a great job in keeping a lid on this virus and subsequently of us all. Hopefully, this will help in some small way and benefit the general population. The people of St. Kitts have been so welcoming and kind to us since we arrived here on the 12th of March. We would like to take this opportunity to say a huge thank you. And this donation comes from David and Wendy from the sailing yacht Mischief. David and Wendy are from the United Kingdom. They arrived here on the 12th of March. They were unable to leave. They were stuck here in St. Kitts and Nevis. And they appreciate the response that the Federation has had to this virus. So to you, David and Wendy, it was a pleasure for me to come to government headquarters today, where you went, to ensure that the NEOC received this donation. And to you, I say, from the people and government of St. Kitts and Nevis, thank you. And we do hope that history for you would ensure that St. Kitts and Nevis is engraved in your hearts and minds. I also want to read a letter from the institutional and community-based pharmacy staff of the Federation of St. Kitts and Nevis, who would have made a contribution. Sorry, the contribution from David and Wendy is in the sum of 1,000 EC dollars cash. The institutional and community-based pharmacy staff of the Federation of St. Kitts and Nevis commends the NEOC team for the outstanding service you are providing to the Federation. We also take pleasure in making our contribution of $500 to the COVID-19 fund. We would like this contribution to go towards the school meal program for the children. So to the Chief Pharmacist for St. Kitts and Nevis, Vanessa Matthews, and the team, we are forever grateful. I also want to acknowledge Denny's and the team at Domino's for their continued support. Domino's keep supporting throughout. It was just today that they lived up to their commitment, where they sent several Dominator pizzas and sodas to the students who are in quarantine. But besides that, Domino's would have sent out, as they continue to do, pizzas to the SSU and the police and other entities. And to that, we are so thankful. And today I received a call at about 4:30 this afternoon from Jackie Martin from New York, who stated that she watches the briefing daily. She says, Mr. Samuel, I have not missed a briefing. She said she would have sent a message to me about a week ago, and she didn't get no response. But Jackie, I'm sorry, I didn't see it. However, today, she said she contacted GQ and asked GQ to ensure that I got the message, which I now have, and she has committed 400 EC dollars for the differently abled and 400 EC dollars for the Cancer Society. So to you, I say thank you. All these small gestures go a long way for all of us. Yesterday, I would have mentioned to you that the 911 would have recorded a total of 77 prank calls. Today, just before I came, I had the privilege of speaking to the supervisor on duty. And she would have stated that she would have taken over from 3 p.m. And between 3 p.m. and 4:30, they recorded a total of 22 prank calls. 22 prank calls. And from this 7 this morning to 3 p.m., a total of 66 were recorded prank calls. From this morning to right now as we speak, a total of 88 prank calls have been recorded. I am appealing to parents, I am appealing to all adults to cease and desist from this action. You are leaving us without any option but to pursue the heavy hand of the law towards you. I asked the supervisor, what are some of these calls? She says to me that it's sometimes the adults, they call and they give the operators bad words. They call and just hang up. Others are children who are playing with the phone. Again, I'm going to ask every responsible citizen in St. Kitts and Nevis during this pandemic, during a crisis, to exercise responsibility with this. We have persons who need to access these services for real life situations. I want to also bring to your attention that the new norm is not the old norm. You see the lines at the supermarket, they are going to be long. Reason being, the capacity of occupants on the inside of a business has been reduced. There are protocols whereby you have to now be spaced according to the regulation on the outside. So if you don't want to wait long in lines, you have to adapt to the new norm. Go to the supermarket earlier, find time. Let us not be naive to the successes that we have made and drop your safeguards. It's important. Today, while driving around in the Bastia area in particular, I saw number of persons, in particular younger ones, not wearing masks. I had some masks thanks to Shauna, who gave some masks, and Justin, and I was sharing them out to some of the younger fellows and said, wear masks. Let us not break the law. The law says you must wear a mask, please wear a mask. And I want to thank those youngsters for accepting the mask. I was also reliably informed today that after the Prime Minister would have announced the easement on the beaches, persons took to the beach this morning. I don't think you are happier than I am that I am going to be able to go to the beach as of Monday. Not today, not tomorrow, or Sunday, as of Monday. Let us be good, law-abiding citizens. I had a group of elders who would have called me several times, getting down on me that they need to go to the beach. They waited and waited on the process, and it's a methodical and gradual process that we are having in order for us to be a successful federation against the COVID-19 virus. I had extensive discussion with Junie. Junie Liebert and I would have had many discussions on the beach, because he said to me that that's one of his means of exercising, but it is for me as well. And I have waited and waited and waited. So I need you to wait as well. Every process is calculated. Every process is inclusive of consultations. And to the lady who cussed the man for Nemo, you waited and you're getting the beach. So let us be patient with this process. Another matter that was brought to my attention is the mask. Those masks that are made of cloth. Persons that are complaining have brought complaints that the elastic that are on these masks are too tight, they're pulling their ears forward. I think that matter has been discussed. If a mask is uncomfortable for you, find a mask that is comfortable. That's the simple solution I will give you. Okay? With that said, I want to thank all of you for your continued support, prayers. Let us remain vigilant. We are not out of the woods. So those individuals who still have the liming vibes in them, going by the corners, drinking the rum, going in the area to lime without that 6 feet distancing, please do not put others in jeopardy. So I want to wish the mothers a happy Mother's Day in advance, as Ms. Vesta Southwell will be reporting on my behalf for the next couple of days. That's Saturday and Sunday. So to all the mothers, you may not hear from me on Sunday, but please know that I carry you in my heart with special wishes. I will now call upon Ms. Merceline Hughes, Chief Immigration Officer and the head of the Compliance Task Force, to give her report as it regards to the task force activities for the week and for today.
Good afternoon, all. The COVID-19 Compliance and Enforcement Task Force began operations on April 20th, 2020, with a mandate to ensure that businesses within the public and private sectors adhere to guidelines outlined in the Emergency Powers Regulation and any other regulation that followed during our state of emergency. We have a new SRO, as Mr. Henry stated earlier, that comes into effect Saturday the 9th, and it will go until Saturday the 23rd. The purpose of the Compliance and Enforcement Task Force is to ensure that businesses and public transportation, including buses, taxis, and ferries, comply with the health and security measures outlined by the government of St. Kitts and Nevis on the advice of the National Health Operations Center and the National Emergency Operations Center to ensure the Federation remains a safe and healthy place to live, work, and do business. The objective of the task force is to ensure strict adherence to the regulations outlined in the various SROs on the relaxation of businesses to operate during the days of limited operations, and from last night we were told that those days will now increase to 5 days, Monday to Friday, in the next week. The task force is made up of officers from the Royal St. Christopher and Nevis Police Force, the St. Kitts Nevis Defence Force, Customs and Excise, Fire and Rescue Services, Environmental Health Department, Consumer Affairs, and the Labour Department. At this time, I wish to thank the men and women who work tirelessly, who suffers hostility by a few, especially some of those bus drivers, but are encouraged by the majority of civic-minded individuals. The task force has a number of areas of focus, and those include Regulation 7, which does not change, has been the same since the regulations came into effect, which speaks to social and physical distancing. Regulation 14, that speaks to suspension of all retail liquor licenses. Regulation 15 speaks to the wearing of masks in public place. Regulation 8 speaks to the passenger buses and ferries and the number of passengers that each can carry. Regulation 17 speaks to the hygiene protocols, and Regulation 18 gives the power of the COVID-19 task force. Regulation 19 speaks to the penalties for breaking any of these, and the penalty could be up $5,000 or 6 months imprisonment or both. At this time, I would like to say thank you to Mr. Kennedy De Silva, Controller of Customs, Sergeant Sophia Henry, who is a liaison officer for the task force, Mr. Osbert France, Mr. Abia Samuel, Mrs. Langley Stevens, Dr. Hazel Laws, our CMO, Miss Ophelia Blanchett, Miss Kebas, Miss Petty, and especially to the Chamber of Industry and Commerce, who are assisting us greatly in ensuring that their members adhere to the regulations. I would also like to thank the staff at Immigration, especially my deputy, as well as my management staff, who allowed me to spend a lot of time here as we have to deal collectively with this pandemic to ensure that our nation keep level that curve that we also pray and hope for. So I said earlier that the task force was established on the 20th of April, and from the 20th of April to the 8th of May, today, we visited 852 businesses. We got statistics from the Inland Revenue indicated that we have over 5,000 businesses in St. Kitts. And so it will take us quite a while to get to all of them. We have completed 852, and these businesses range from salons, barbershops, bakeries, clothing stores, doctors' offices, supermarkets, mini-marts, government departments, pharmacies, furniture traders, hardware stores, professionals, food vendors, taxi operators, bus operators, rum shops, broker agents, restaurants, village shops, lawyers' offices, car dealership, bank, insurance, and other, which includes construction site, mechanic shops, and welding shops, etc. So far, we have seen that of the number of businesses adhering to the 6 feet distances is 494 of the 852. 30 square foot per person observation, we have 317. Distance marking, 299. The face mask is posing a little bit of a problem, but it is still very good because it's 695 of 852. And we are finding that, as most persons would have said before me, that the majority of persons are observing these, but we still want to ensure that everyone adhere to the wearing of the masks. The sanitization of the doors The latest thing that the bus drivers are asking if government is going to give them the sanitization because they cannot afford it. I would just want to, at this stage, encourage all of us to be our brother's keeper. We all see persons who are not wearing their mask. We all see persons who are not observing the 6 feet distance. I mean, I drove across the Bay Road this afternoon coming here, and the line of persons I saw at a supermarket, and everybody were so clustered, but the police officers were there trying to ensure that persons maintain distance. So let us continue. We are on a good path. We've leveled the curve, but we have heard about what can happen if we have a surge, a second wave, and so let us all endeavor to keep that curve down at the bottom where it is right now. Thank you very much.
Thank you, Ms. Hughes, and thank you also to Mr. Samuel for your reports. This brings us to the question and answer segment for today. We'll start the ball rolling. The first question goes to Dr. Wilkinson. The CMO spoke 2 days ago of the benefits of remdesivir in fighting COVID-19. Today I learned that there is a shortage of this drug in the United States. Do we have it at our hospital? And what's the plan if we don't, in light of the shortage? And the second question, when plans were being put in place for the curfew, wasn't any consideration given to Mother's Day, which is this Sunday?
Thank you, Leslie. To the first question, yes, the CMO spoke about remdesivir about 2 days ago, and this is a broad spectrum antiviral drug that one study showed that it is beneficial in fighting COVID-19 in persons who have severe disease. And the study in the United States showed that it has reduced the hospitalization from 15 to 11 days. And yes, recently it was announced that there is a shortage of remdesivir. I think they only have enough for about 200,000 patients. But let me just do a little analogy here. I like to draw a fence here, and this is the United States, and this is the Federation of St. Kitts and Nevis. So I'm going to step briefly into the United States first and look at the situation there. Today, we have in the USA about 1.3 million cases of COVID-19. We have over 78,000 deaths. In the last 24 hours, there were about 3,000 deaths. Let me step back into the Federation of St. Kitts and Nevis. And today, we had 15 positive cases, 13 have recovered, so we only have 2 active cases, and they're all doing well. To date, we don't have any persons hospitalized, we don't have anybody on a ventilator, we don't have any deaths. And basically, what we'll continue to do is what the CMO just outlined that we were doing. And so for the shortage of remdesivir and the only 200,000 vials that are available for patients, I say that yes, we can leave it in the USA since they need it much more than us, and we'll continue to flatten our curve, and hopefully we will avoid a second surge and we would have no use of remdesivir. But I'm pretty certain that if things develop and the drug becomes more available, we will definitely have some of it here. As it relates to Mother's Day, yes, Mother's Day is a very special day on the calendar. It's a day when we celebrate the influence of mothers on our society, motherhood, and the mothers in our lives. And so it's a very special day that is celebrated throughout the entire world, and one of the most popular celebratory days on the calendar. And it is because we love our mothers and our grandmothers why we considered them in our plan, yes, because the reason why we have the curfew is to protect not just our mothers, but the entire society. And one of the best gifts that you can give to your mother or your grandmother, especially if you're not living with them, is to stay away from them, because you don't want to go and visit them on this Mother's Day and give them a hug or kiss, and that hug or kiss that you give them might be the last, because you might be the one who is bringing this deadly coronavirus to them. And so to all the mothers out there, I say happy Mother's Day, and this is a new norm, and for this Mother's Day, I would suggest that you try and stay away if you're not living with that special person, and you can do it differently. We have a lot of means of communication. You can send them a text, you can call, you can have a Zoom meeting, you can speak to them virtually. And so I do hope that every single one enjoy their Mother's Day, and just know that we took all the mothers into consideration, and we took every single life in the Federation into consideration when we were thinking about the curfew and the stay-at-home policies. I thank you.
Thank you, Dr. Wilkinson. This next question is from SKN Newsline. There seems to be some uncertainty being expressed regarding the $1,000 package of assistance provided via the Department of Labor. Please explain again the qualification criteria and the actual monetary assistance that an applicant would receive. Attorney General.
Good afternoon to everyone. We have had the Department of Labor here a couple of times, as well as Social Security, and we will have them back again to be able to explain it once more. I think the details have been made, and I'm hope that you can get clarification so that there's no confusion when they do return. Thank you.
Thank you, Attorney General. This question is for the Postmaster General. Are the services for child maintenance payments in operation?
Good afternoon again. The answer is yes. So any child maintenance services payments, yes, you can come to the post office and fulfill that. Thank you.
This question comes from a concerned citizen, seems to be a mother who is in some distress. Since the start of the state of emergency and closure of school, I have been home with my children. One of them goes to daycare and the other attends preschool. My spouse is an essential worker who has to work every day. I have been given the option to work from home because of the children, but it has been very difficult for me. Taking care of them by itself is a whole day's job. Because of their age, I particularly have to watch them closely and often find myself weary and worn at the end of the day. With my office work still to be done, kindly provide any advice on how I can manfully get it done and still remain mentally sane. Also, is there any conversation presently being conducted with early childhood to reopen at least the daycare centers to begin with? It's really difficult to work from home with a baby that needs your undivided attention all day. This question is either for the Attorney General or for Mr. Samuel, but the Attorney General seems, or the Chief Medical Officer. Who will we go with? AG, CMO, or NDC? Chief Medical Officer, CMO.
As I listen to the comments, Mr. Williams, from the person who posed these questions, I must say I empathize with her in terms of the demands at home with respect to her 2 children, and then her work demands. And so from where I stand, I think she is in need of support at home. And so I'm appealing to her to look more closely at her social network in terms of their siblings, friends, family, loved ones who can provide her some support, some relief, every few days, such that she can, maintain her mental health and still meet the demands of her work. And so I also want to tell her that there is a 311 number she can call, and then she can be given the psychosocial support numbers. So she can speak to the psychosocial support team who can provide her professional help in terms of her maintaining her mental health. Thank you.
Thank you very much, Dr. Laws. I wanted to share with you a note that I had from someone that looks at what Canada has done in terms of their plan to gradually get back to normalcy. The World Health Organization has said that each country has to do what's best for them, and there's no one size that fits all. And we in St. Kitts and Nevis have been cautious but careful in gradually opening up to get the economy back to normal, to gradually get back to some sort of social engagement. This is government's roadmap to ease COVID-19 restrictions, and they are set out in 5 phases. These phases will be on a 3-week review process. The current phases would commence on the following dates. Phase 1 for Canada would begin on the 18th of May, Phase 2 on the 8th of June, Phase 3 on the 29th June, Phase 4 on 20th July, and Phase 5 on the 10th of August. And I quickly looked, there are a whole list of how businesses get back on various things. In Phase 4, the roadmap will lift the following restrictions, and these speak about travel will be extended to outside of your region, larger household visits will be permitted, small social gatherings will be permitted, such as baptisms, small weddings, etc. And I came here because you asked about you being confined at home and wanted to know when our creches and so forth will be open. Here, creches and preschools will reopen for all other children, and this is way down, would be in June or July that they have. So that various countries, and it's a whole list of regulations that will be lifted over time. We here in St. Kitts and Nevis have begun by gradually having more days for economic activity, limited operations for businesses. Next week we go for 5 days, Monday to Friday. We extend the working day to at least 6 o'clock, and you can have the actual nightly curfew begins at 8 p.m. and go to 5 a.m. the next morning. So the gradual process, it is difficult, but it is for all our safety and our protection. We all see what's happening in other hotspots around the world. In New York, you're having more than 2,000 deaths per day. And many of us know people in New York City and elsewhere that have succumbed to the COVID virus. Recently, one of our former musicians, Val Parry, passed away earlier this week from COVID virus. And we know others in Keon, Ban and others like that who have passed. It's not something to play with. It's very serious. So there will be some frustration, there will be some difficulty, but we all have to stay the course. Be very careful, very cautious as we gradually get back to a sense of normalcy. It will take some time, but have it. Stay the course. Thank you.
Thank you, Attorney General. This is not a question, but rather a commendation. No question today. Simply to commend the health officials on the breakdown and analysis today, of course, which the Chief Medical Officer gave. The information is clear and transparent. Hopefully, persons understand their role in this process. These two questions, one is for the CMO and the other one is for Mr. Philip from STEP. How can contact tracing be possible if someone tested positive, said they were in a supermarket 2 days ago? How will they track down all those who were in the supermarket during that time? And the other question, since some of the STEP program workers are attached to some farmers, can they provide any kind of startup assistance to backyard farmers, such as land clearing? And another question for Dr. Laws. This person is suggesting that in the report, only the confirmed cases worldwide are given and the deaths. What about the recovered cases to sort of give people some sort of a positive?
All right, so I appreciate that question regarding contact tracing. And so they gave a scenario in terms of if you have a confirmed case and that confirmed case says, hey, I was in the supermarket 2 days before, how do you track all those persons? Okay, so contact tracing is a science. Basically, we have to interview the case. It's an in-depth interview whereby the individual is asked to reflect on the previous 14 days, and we pick out the significant contacts. Spouses, that's significant. How many persons live in your household, that's significant because you would be interacting with your spouse and other members in your household significantly. You spend a significant number of hours together, you talk closely, exchange of ideas, etc. And so in terms of contact tracing, we first look for significant close contact, persons with whom you interact for hours on end, closely, whereby you speak, within 2-3 feet of each other. And so those are the contacts we focus on. Now, if you go into a supermarket, you walk from shelf to shelf, those contacts are passing. not much time spent. You may not even interact or speak to anybody for a prolonged period of time. So those are passing contacts. Now let me just share some of the science behind this. Now, in January or February, there was a study done in the United States of America whereby they looked at the number of cases, and then they looked at all the contacts for those cases, and they determined and picked out those contacts who eventually tested positive. And what they found was it's the very close contacts who converted and tested positive, particularly spouses, husbands, wives of cases, and the persons who lived in the same households. So what we took away from those, those papers or scientific evidence is that you have to be a close contact for you to have an increased risk of picking up the infection from a case. And so it's not impossible for a case to say walk into a supermarket and pass it on. But what I'm trying to say is that the risk of so doing is very minimal and small. What was the other?
The question was recoveries. Recoveries are not in the report.
The world recoveries. There's a reason for that. That data is not verified, and so we don't really emphasize that data. We share with you daily the total number of cases, and again we utilize the World Health Organization site because the data from WHO is verified through the International Health Regulations mechanism, and also from that site we share with you the number of deaths. However, the number of recoveries is not verified, and so by extension we do not really emphasize that. Thank you.
Thank you very much, Dr. Laws. While I listened to you and the last question in terms of the contact tracing, and if somebody who was in a supermarket, for example, 2 days ago, then was discovered that they were confirmed with the COVID-19, I think that is why, for example, like pharmacies and supermarkets, that they have to adhere to certain protocols, that people must wear their masks, for example, and they must sanitize their hands at the door and all of that sort of a thing to mitigate that sort of thing. I just wanted to add that. This brings us to the end of the question and answer. Oh, I forgot Mr. Philip. That's right. Mr. Philip? Yes.
I just want to say that the STEP program worked closely with the Ministry of Agriculture. We are interested in food security. So once you have assigned STEP trainees and you're a participant in the STEP program, we can seek some assistance from the Department of Agriculture to have your land being cleared and to have your land being plowed. As a matter of fact, I want to take this opportunity to say thanks to our STEP interns who still assigned to the farms. During this period of lockdown, we have managed to get a large number of the STEP interns who are involved in farming to go out and do their farming with the farmers. And as a result of that, tomorrow, the farming community in Keon. A number of farmers has come together and have put together a number of farm produce. And what we are going to do tomorrow, we are going to be going around in the Keon area from 10 in the morning to 1 o'clock in the afternoon, and we're going to be distributing a number of those farm products to the less fortunate persons, especially the senior citizens who are mostly affected by this COVID-19. So yes, we can help you to get some assistance to have your land tilled.
Thank you, Mr. Philip. I'm sorry for forgetting you there. We've come to the end of the question and answer segment. I do have an announcement from SCELEC. SCELEC would like to advise the general public that an electricity supply outage is scheduled to affect Kitishan Hill Resort tomorrow, Saturday, May 9th, 2020, from 10 a.m. to 1 p.m. The outage is for emergency maintenance purposes. Please dial 465-2013 to contact the SCELEC emergency hotline for further information. Right. Today is also the World Red Cross Day, and we say congratulations to all members of Red Cross. We have Red Cross members here in St. Kitts and Nevis, and they continue to offer support as well, psychosocial support and other forms of support, first aid and things like that in terms of disasters and other health hazards and environmental hazards. So we say congratulations to the members of Red Cross, locally, regionally, and internationally. I would like to thank Mr. William Phillip for his presentation from the STEP, Mr. Dario Gill, our Postmaster General, the Honorable Wendy Phipps for sharing the good news of Mr. Vernon Connor, who turned 100 years old. Quite a feat in this day and age. And also Superintendent Cromwell Henry, Divisional Commander for District A, our Chief Medical Officer, Dr. Hazel Laws, for a very enlightening presentation done today by PowerPoint. Mr. Abdias Samuel, Chair of the COVID-19 National Task Force, and Ms. Mercelyn Hughes, who is Head of the Compliance Task Force and also Chief Immigration Officer. I thank the Attorney General for his usual candor in answering the questions. Sometimes the one that no one else wants to answer, he takes them. We thank Dr. Cameron Wilkinson, our Medical Chief of Staff, as usual, for his support in being here to answer questions. We also thank the media, ZIZ, Open Interactive, and all media in the Federation of St. Kitts and Nevis who continue to work to disseminate information and to educate the public on the COVID-19 pandemic. We have seen a lot of improvement in terms of the misinformation that is peddled out there. It has been cut down, and to that we are tremendously grateful in terms of that. And it can only be attributed to a proactive approach where we have been providing information that is credible, reliable, and timely to the public, and it is certainly bearing the fruit of that out in the public, which can only redound to the good of us all. I want to thank the SKNIS staff for their attention to the briefings, and they continue to write on the press briefings and so on. I thank them very much. We continue to thank all those persons. Mr. Samuel comes here and he speaks about all those persons who donate to the cause, to the fight against COVID-19. All who continue to work at the National Emergency Operations Center day in and day out. Very dedicated soldiers to the cause, to the fight of COVID-19. We thank them very much. Thank you very much for tuning in today for another briefing, COVID-19 daily briefing. Tomorrow we will be back. We are not getting weary, and so therefore we do not wish for you to get weary either, because this is a very important time that we have to come together, all of us in society, all of us in government, all of us in the region, all of us around the world, to remove this threat, this health threat from among us, and to preserve lives. Tomorrow we'll be back. Until then, take care. I am Lesroy Williams.
Before touching the mask, clean hands with an alcohol-based hand rub or soap and water. Take the mask and inspect it for tears or holes. Orient which side is the top side where the metal strip is. Ensure the proper side of the mask faces outwards, the colored side. Place the mask to your face. Pinch the metal strip or stiff edge of the mask so it molds to the shape of your nose. Pull down the mask's bottom so it covers your mouth and your chin. After use, take off the mask. Remove the elastic loops from behind the ears while keeping the mask away from your face and clothes. To avoid touching potentially contaminated surfaces of the mask, discard the mask in a closed bin immediately after use.
Is on.